Assalamu alaikum. Today we are discussing the kidney problems or the kidney diseases. One is the chronic kidney disease. Second one is the pyelonephritis. Third one is just because of the bacterial infection or the bacterial toxins or any kind of mycotoxins which present in the diet that affects on the kidney. The swelling of the kidney is there. So basically, first of all, we are discussing the main functions of the kidneys. One of the topmost is the acid-base balance, electrolyte balance, and the maintenance of the pH or the blood pressure. Fourth one is the secretions of the certain hormone, the glycoprotein hormone, that is erythropoietin. That initiates the red blood cells formation. So these are the few major roles of the kidney. Once the patient got the kidney problem, then there is electrolyte imbalance, there is dehydration, the waste product removal is the most important function of the kidney. Then there will be no more good filtrations of that waste product from the blood. So the creatine level is high, or the uric acid is high, or the urea concentration is high, the blood urea nitrogen is high. So these are the main problems of the kidney. First of all, to diagnose the kidney, we have to go for certain tests. The LFT is there that give us a complete picture of the parameters in the blood or the blood serum. And other than LFT, most of the time we just go for the LFT. That is not the only test. We have to go for the urine culture, urine analysis. By urine analysis, you will be able to find either there is pus or pus cells or the blood or the bacteria inside. Once the urine analysis is there, if the bacteria present in that, then we have to go for the proper culture of that bacteria. So we will have the pinpoint diagnosis, like most of the time the E. coli infection is there. After then, with the culture, if your cat or dog is positive for any bacterial infection, any yeast infection, or any other fungal infection, so then we have to run the sensitivity test for the that bacteria. That got good results. If that bacteria is resistant to certain antibiotic and we are using without testing, then there will be no results. So if we are going for the proper testing of the sensitivity test, then we will have a complete picture. Then there will be a list of the antibiotic in which few of them could be like resistant to that one. That bacteria could be resistant to that one. Some who got really good sensitivity, then we have to select the topmost antibiotic which shows the sensitivity against that bacteria. That bacteria against shows sensitivity against that antibiotic. So that is the one thing. So for the kidney patient, we have to keep the patient hydrated, number one. Number two, we have to balance the electrolytes by giving normal saline and the ringer lactate. And once the kidney is affected, so certain urotoxins also secretes, and that acts on the stomach, and the gastritis is there, sometimes the gastric ulcer is there. So the digestive system is also affected. So you have to manage that gastric issue by minimizing the gastric secretions, and using of the probiotic got good results, because the probiotic itself have good results in the health of the microorganisms that involves in the digestion. And the second effect or the of the probiotic is that minimize the urotoxins. So you should add the probiotics, and the along with the treatment of the kidney, you are maintaining the electrolytes by giving the IV infusions. You have to focus on the stomach also. The stomach management also added like Ryzek and the probiotic also by orally. And third thing is the most important is kidney is affected, so the red blood formation is not there, and your patient with the chronic kidney disease or any other type of diseases, gradually that the loss of appetite is there, the loss of weight is there. So you have to maintain that by giving externally that glycoprotein erythropoietin that is commercially available in different name, like epokine is one of that that got this protein that is 4,000 international unit. So if you go for the by weight 0.7 to 1.5 mcg per kg is the dose rate of the glycoprotein hormone erythropoietin for the cats. So you have to use that one for the formation of the blood. So while treating kidney patients, you have to see the side effects of the kidney antibiotics on kidney, because you are using an antibiotic if that is nephrotoxic, then instead of getting better, your patient will go in worse and worse condition. Right now most of the antibiotic, like 80 to 90%, got severe side effect on kidneys that cause toxicity and damage to the kidney. So because the filtration is compromised with the kidney patient, so the side effects is always there. So you have to the technical thing is the selection of the antibiotic. Well, the penicillin group, amoxicillin, or with the name of augmentin, or empiclox, got the good results is in case of kidney patients, because that is more safer than all other antibiotics. So in your practice, you have to keep in mind regarding the use of antibiotic also. Well, once you started the treatment, then we discussed like we have to maintain the electrolyte balance. Second thing is you have to add some energy and multivitamin source in the drip. Third is the external source of the erythropoietin protein, so that the formation of red blood cell continue for the patient. And the fourth one is the antibiotic. You have to select the best antibiotic for the kidney patients. Rest is the loss of more fluid is there during the course of the disease, so you have to keep the patient hydrated. And the top most important is the diet plan. You have to give good quality diet in that case. Normally I used to add the chicken yakhni, the egg white, and the chicken or the whey protein commercially available. Mesh it and make it very thin liquid type, and serve to the patient so that he will get energy for at least 4 to 5 times a day in gap of 4 to 5 hours. So thank you so much.